Ribs anatomy. General anatomy of ribs. Human have 12 pair of ribs forming the thoracic cage. Function: protect vital organ, heart and lungs, assist respiration, provide muscle attachment. Classification: two ribs 1 to 7 attach directly to sternum via costal cartilage. False rib 8 to 10 attach indirectly via cartilage of rib 7. Floating ribs 11 and 12 no anterior attachment. Typical rib structure 3 to 9. Heads has two facets articulates with the bodies of adjacent thoracic vertebra. Neck narrow part between head and neck tubercle. Tubercle articulate with transverse process of vertebra. Angle site of maximum curvature. Shaft body flat and curved. Costal groove on inferior border contains intercostal vein, artery and nerve. Atypical ribs. First rib short, broad, flattened groove for subclavian vessels. Second rib tuberosity of serratus anterior. 10th rib single facet on head. 11th and 12th ribs single facet no neck or tubercle floating ribs. Joints of ribs. Costovertebral joint, head with vertebral body. Costotransverse joint, tubercle with transverse process. Costochondral joint, ribs with cartilage. Sternocostal joint, cartilage with sternum. Muscle related to ribs, intercostal muscle, external intercostalis, elevate rib, inspiration, internal intercostal ribs, depress ribs forced expiration, innermost intercostal, assist internal intercostal, accessory muscle, diaphragm and primary muscle of respiration, sklenies, elevate first rib, serratus anterior, protect scapula, assist rib movement. Pectoralis major and minor, assist forced inspiration. Latissimus dorsi, expiratory role during the forceful breathing. Levator's costorum, elevate ribs. Ligamentum of ribs. Costovertebral ligament, radiate ligament, interarticulate ligament. Costotransverse ligament, proper ligament neck to transverse process. Lateral costotransverse ligament, tubercle of transverse process. Superior costotransverse ligament, neck to vertebral above. Sternocostal and sternochondral ligament, reinforce rib sternum and rib cartilage junction. Movement of respiration, pump handle movement, upper rib anterior posterior diameter, bucket handle movement, middle rib to transverse diameter increase. Caliper movement, lower ribs flare laterally. Common rib pathologies: rib fracture due to trauma or osteoporosis, pain on breathing, failed chest, multiple fracture causing paradoxical movement, costochondritis, inflammation of costal cartilage, teeth syndrome, chondrochondritis with swelling, sleeping rib syndrome, hypermobile costal cartilage, thoracic outlet syndrome, compression near first rib contusion, soft tissue injury without fracture, metastatic lesion, breast, prostate cancer commonly affect ribs, osteomyelitis, infection of rib rear, congenital anomalies, cervical ribs, bifid ribs.